This will be part 2, the medication part. So definitely, again, if you didn't watch the first one, if I had to recommend you watching either one, definitely this one. This is, I think, again, very well done and very well explained. And the students ask very good questions. So the first video, I believe, was only 21 minutes. So we'll see. I think this one is going to be a little bit longer because I do go into some pretty good detail, but it should not take us all the way to 2 hours and 17 minutes. I will keep an eye on that. All right, so I will begin recording right now. And here we go.
Benzodiazepines for sure. I will mention phenobarbital because I know Nurse Mike does. I normally don't, but I at least want to. Sorry, I think it's mating season for squirrels and they're screaming outside. I don't know what's happening. And then hopefully, yeah, my God, why does this class go so fast? Maybe not to you, but I feel like it's just like, but we'll definitely, Nurse Mike is more important than the video. The other video, even though it's important, and we will watch it, I swear, by the end of this class. So let's go ahead and take 10:28. Want to come back at 10:40? Go stretch, some coffee. Okay, perfect. I will see you guys at 10:40. Thank you so much for, I know it's hard to sit here and listen because we're not like moving and I'm not in person. So I appreciate your patience. So I will see you in about 11 minutes.
Miss Amanda, could I ask you a quick question before the break? Could you repeat what you said about the patient like telling you that their family, a particular medication worked well with their family members?
Oh,
like what would you do?
Oh, yes.
And that, yeah.
So usually, with any medication, I'm talking mental health wise. It could be for something else, but strictly mental health wise. If let's say somebody came in, even for SSRI, SNRI, any type of medication for insomnia, I'm not prescribing yet, but let's say I'm the prescribing physician or nurse practitioner, I find it very important to ask, has anyone in your family who you have a blood relative with suffered with insomnia before? I try to get the most information about it and ask how they've been treated and what has been effective for them, because they share similar similar, not the same, similar genetic components, and the medication can tend to have a higher effectiveness, so that we don't have to continue kind of play, I hate saying playing the game, but playing that game of continuing to switch the medications. That's one way we can be more effective. The second way is, are those DNA swab tests that they can do and send in to see what medications can be better. I haven't seen the best success with those yet. I still go with family. So
okay.
Did that answer?
Okay, great. Okay. Yes, that did. Yeah. Thank you.
You're so welcome. Enjoy your break. All right. Share this again. Paige, you're on my page. Can you hear me? Okay, thank you. I know you just put food in your mouth. I'm sorry. Okay, wonderful. Let's see. All right, perfect. All right, so let's go ahead and continue. Hopefully you guys got a little something done. All right, so we ended here, right? All right, so off-label. So again, no, not again. I know that we know what off-label means. We've gone over it. And we know that it is a medication that was designed for one thing, but we can use it for something else. We've also reviewed that in mental health, that is a very, very common thing. I can't give the exact percentage, but I mean, I would have to say at least, I just don't quote this, but 60%-ish in my experience are used off label. It's very common. And so let's start off with one that I personally think a lot, well, definitely hydroxyzine and propranolol, I got a lot of surprise from. So I think that those were two that I definitely wanted to cover. Although it was in the video, I still think it's important, and then answer questions, of course, and also talk about how they work. And then gabapentin, as we all know, that's one of my favorite. I mean, it doesn't work for me, but I think it's a great medication. So one thing to note as a whole for these three medications is none of them have properties in them that cause, and I'm going to talk a little bit about, I'm not going to go too into depth because we are going to, of course, have a substance use disorder, may or may not be one of my favorite lectures. We will talk about the brain and how what's happening, and it's not just, oh, you're just drinking and because you want to drink, or there's a whole physiological change in your brain with dopamine and receptors and your frontal lobe and how it's working. So I'll give kind of a mini reason why this happens with these medications. Not saying they're bad. I want to keep repeating that because I know for sure, well, not for sure, but I'm guessing there's probably at least 3 to 7 of you that have either taken this medication or are on it right now. And that's not what I'm saying at all. I'm just explaining the medication and the potential risk, because that's what we do as nurses, right? That's our job, is to understand the potential risk and outweigh the benefits with the risks and all of that. Okay, so back to our off-label. Let's actually go, okay, fine, we'll go in order. So hydroxyzine, I think this is one that most people in my experience have not heard of. Hydroxyzine, as I mentioned in my video that I posted, the voiceover PowerPoint, is an antihistamine. So the actual classification of it is an antihistamine. However, I've actually never, and I work in mental health, so maybe that's why I've never seen it used as an antihistamine. I don't know how they use it in the ER or anywhere else. But me personally, and this is a prescription, I think that's important to understand. So every single one of the medications that we're talking about medication wise, these are all prescription. That does not mean that there are not medications that you can buy over the counter that can help with anxiety. Such as, does anybody happen to know, and Kevin, you can't answer this only because I know you've worked in mental health, so this one you can't answer. Does anybody know the precursor for serotonin? What it's called?
H2P.
Right. Oh my God. Just got a new preceptor. What a precursor. Precursor. So that would mean if you didn't want to, just as an example, because I think it's important to talk about things also that are over the counter. There are over the counter medications that basically have induced 5-HTP in your brain. Therefore, what does that stimulate? Serotonin. So that could help with depression or anxiety if somebody wanted to do that on their own. Of course, letting our patients know the potential for serotonin syndrome, because then what if they were prescribed something at a point where they just, that's why it's so important to ask, what are you taking over the counter, not over the counter, supplement, everything. I want to know everything so I can get medication reconciliation. I believe I talked about that on the video I just posted, but still, I want to really, really make sure that that's understood. So that's just an example of a supplement that can be used. And that can also be used, GABA. There's a lot of stuff. I'm just kind of touching on the highlights. There are several over the counter GABA supplements. are not gabapentin, but they do help with GABA. Because also with anxiety, as we talked about with serotonin, low levels of serotonin can cause anxiety. Anxiety can just be caused, like I said, from all the other stuff. Did I list it somewhere? I did, didn't I? Right here, I'm gonna mention, I'm just gonna put in little here, so low serotonin. GABA, I do, but low GABA in the brain. Well, that's another thing that can happen. So if you have low levels of GABA in your brain, that can also cause anxiety. I can't teach you every single thing that's going to cause anxiety, but if we can hit those highlights and you know, I think that's what's important here. So there are several over-the-counter supplements for GABA and just good brain health, right? So not saying that medications have to be the answer to everything. With that said, I do want to say something though. If somebody is so anxious that they can barely function in life, sometimes, and if you're okay with it, maybe one of these medications, maybe using Ativan or Klonopin or whatever, one of these benzos, and we'll talk more about them when we get to them, for a short period of time, because how am I going to learn coping skills if I want to rip my face off? That's literally what I say. Because I've seen patients, it is one of the most painful things other than withdrawal from drugs and alcohol to watch for me personally. To see somebody so anxious that they just want to crawl out of their skin. It can be very hard to focus. If you, let's say you're going to groups or therapy and you're not able to take in what you're learning because you're so anxious. So sometimes these medications can be really good. I mean, any of them. But in my personal opinion, these ones here, like the ones that are going to work quicker, because we've already talked about how, so Buspar, I think it's about 2 weeks that it kicks in. Nurse Mike says, I think it's 2 to 4 weeks. The SSRIs we know take much longer. So while this person is in that acute, and I mentioned this in the video and it was a little bit confusing. I had a couple questions, no problem. Always email. I talked to, I think 2 people on the phone about it. I want you to understand this. So never, please be afraid, or not like afraid, but that you can't reach out to me. I don't want you to wait a week to find out. So that's one reason why I like to mention that for coverage. And I saw this so much at El Camino, especially in our adult mood programs and our what are they called? I forget the name of it. It's the teen program for the teens and in the addiction groups. And we had, I think, several different types of groups or types of programs. So being able to say, okay, you know, let's use let's try low dose of Ativan, because we always want to start low, right? Because we don't know how it's going to affect you. Let's start low. Let's try some Ativan, and I'm gonna give you you know, we'll do this for about a month. Have you come into group, and I'm not gonna have them all sedated because being super sedated won't help either, right? So that may be just something that we can do to help somebody be able to focus and take in. Okay, now I know how to handle coping. Maybe the coping strategies will start to help better. And then they're getting better because they're getting therapy or whatever it is. I mean, I have to keep this to some sort of a brevity, but there's so much you could do. Or I can say, so for me personally, and unless it depends on the patient situation, I would probably go for something like GABA first, gabapentin, or hydroxyzine. Propranolol is not only, I know I mentioned in the video, it's not only for public speaking. You can use it as an anti-anxiety, but in the short term, usually. You don't have to remember that. I just want you to know that why you're giving your patient a medication. So if you walk into MedSurg tomorrow and you have a patient that is on medication and you're reading it and you're reading through their MAR and it says propranolol, PRN 10 or propranolol 10 milligrams, PRN, Q 6 hours as needed for anxiety. I want you to be able to go, oh, I know that, I know what, oh yeah, okay, you can use it off label for anxiety. And be able to understand that. We should always know why patients are taking their medication and not just automatically look at it and say, well, I know it's an antihypertensive, it's a beta blocker, they're taking it for blood pressure. Because that may not be the case. We should always know why they're taking their meds. That's one of my biggest things in clinical. Of course, I'm nice about it. I don't yell at you. If you don't know, that's how we learn, is hopefully in a positive environment. So anyway, I wanted to kind of just mention that real quick, that can happen. And Sophie.
I just had a quick question about propranolol. I was working in my mental health clinical last week. I was working with a nurse, and she was administering propranolol off label for, I think, restlessness or something related to akathisia. And I just wanted to see if that's also pretty common.
I'm going to tell you from thank you for sharing that. Love personal stories. I think that they help so much. I personally have not seen that a lot, but that just could be where I work. But that makes absolute sense. And I think I'm sure you made that connection, and hopefully felt like if you hadn't heard the lecture prior, even after it went, oh yay, it really, she really did mean I'm going to see this somewhere. So absolutely, because the beta blocker, as we know, helps to lower the heart rate, therefore lowering the blood pressure, therefore relaxing the body, hopefully. And that's probably why they were giving it. But no, I've not seen that, but I'm glad that you mentioned it. I'm not going to quiz you guys on that, don't worry. Don't be mad at Sophie. We're not adding that to any of the questions, but that's a great example. I've never heard it for akathisia. But restlessness, that I have, yes, absolutely. Restlessness and or anxiety, they're pretty similar to some degree, or restlessness is a symptomology of anxiety. Oh, but akathisia, no, I haven't. That's really interesting. I'll have to look that up. Did you happen, it's okay if you didn't see everything, but did it seem to be effective for the akathisia?
I don't think I was there for long enough.
Okay.
But definitely, yeah, I think for like restlessness.
Okay.
There were like 2 patients who were taking it off label.
Okay.
On that day.
But I'm so glad you saw it. That makes me feel really good about like this. Even if you're not in I think I asked you guys this question. Can you pair? Was that you guys? I think because I don't ask every single one of my psych classes the same thing, because you're different and you're at different levels. You guys are right now my highest level of education for BSN. But I did ask you guys, can you connect clinical to what you've learned in class? I did, right? Okay, yeah, and it was you guys then, and I was so happy because I heard so many cool things about therapeutic communication, and it had nothing to do with working inside, but I was hoping that you were able to kind of remember back from way back when I said, this is going to help you everywhere you go. So that was kind of a reflection on that. And I really enjoyed it. I don't think I'm not sure if I read them all yet, but the ones I read, I was very happy. So thank you for giving really good examples and utilizing the skills. So perfect. Thank you for sharing that example. That was awesome. So yes, hydroxyzine, as I said, where I work and in my experience, I've only seen it used off-label use for anxiety. So I don't want to confuse you, and I wasn't going to say this, but of course I'm going to say it. There's 2 types of hydroxyzine. I don't want to get too focused on that. I want you to just know, so there's hydroxyzine, HCl, and hydroxyzine. What I just want you to remember is that hydroxyzine can be used, both of them are antihistamines. One causes one to be more tired than the other one. The one that tends to cause you to be more tired is not the one they give you for anxiety. I called my pharmacist who's a friend. I'm very lucky when I opened my first business with. And because I had heats on my fingertips, right? And so instead of looking it up and having to take forever, because I want evidence-based practice, and he explained to me that they give a different one for anxiety. They're very, very close in molecular structure. So that's what I want you to remember. And to be honest, I don't remember which is which. That's why, because that to me, I just know that hydroxyzine can be used for anxiety. And I'm sorry, you can only remember so much. And there's I feel like my brain needs to be, I need more neurons. Paige.
Can I just clarify, the non-drowsy one is for the anti-anxiety off-label?
Correct, but I will say,
Okay.
and thank you for asking that, but what I will say is that several people do feel or will feel a little bit drowsy because it's supposed to cool you down. So for some people, unfortunately, they can't handle this medication. They have to change them to something else. So it can be a little more sedating, but not for everybody. So it's just like with anything. So hydroxyzine, gabapentin, both can be sedating, depending on how much you prescribe. So we can always lower the dose, but we still want the therapeutic effect. And you don't need to know, I'm not going to test you on the doses. And even though I've mentioned, gabapentin, the reason I like it is because you can go from 100 to 4,000 milligrams, which I think is really great to be able to work with. So, great question. So just remembering that hydroxyzine, it's used off-label. It can be used for anxiety. We use it a lot. These three we use a lot in the recovery world of somebody who wants to be in an abstinence-based program for recovery of addiction and drugs. Not saying, and this is why I'm so happy to see this now, we're seeing more prescribers prescribe medications that are not potentially habit forming. Again, not saying they're bad, but let's try it first. Because if it works, then okay, cool. But I may need, and this is what I mentioned that confused a couple of people, maybe in the beginning, if we start off with one of these, maybe we might need one of these in the beginning to help because we just have so much panic. We're about to just not be able to handle it. Or we can try one of these. It just depends on the provider. I don't want to get too far into that. There are so many factors that go into it. So I think we understand hydroxyzine well enough to understand that it can be given and people sometimes take it for sleep too, because like Benadryl, right? So it can help with sleep as well. So they can take less during the day and then more at night, double dip, right? Less is best. Just mentioning that. I won't test you on it, but just for fun. Same thing with gabapentin. We do this all the time. If I'm seeing a patient that's on gabapentin, which is considered as the classification is an anticonvulsant, but we use it for a lot of things: restlessness, agitation. It can help with mania. It's not prescribed for mania, but it can help because when someone's very, very manic, they may be on a mood stabilizer, but we can still give them gabapentin, right? Because it can help lower the central nervous system. We use it for neuropathy. We use it for so many things. But specifically for anxiety, we use it off-label because in this one, again, it's not considered to be habit forming, and the therapeutic range is so large. We can give, okay, let's just say somebody's taking and it's working for them. It can be taken by the way, all of these can be taken consistently or when they're feeling anxious. It doesn't just have to be as needed. So off-label can be given PRN or prescribed, right? So if somebody has anxiety, they can take this just to prevent it, and that's fine. Or it can be used PRN, or it can be used both. But usually they say, okay, don't go over this amount. And the person, it depends on how it affects you and how tired you get. My favorite thing that can happen is when somebody comes in and let's say they have, and not that they have anxiety is good, but they have anxiety. They get on a great dose. They take 300 to 600 milligrams, Q 6 hours as needed for anxiety. Not to be taken more than 3 times a day. Then at bedtime, takes, I'm just making this up as I go along, 1200 milligrams PRN for insomnia. Isn't that beautiful? Using the same medication. It's one medication. They're responding to it well. It's working for both. It's not habit forming, meaning that we can't abuse it. I said that in the video last, we can abuse anything. If I just wanna come home and feel, let's say, like, I just wanna be out of it because I can abuse Benadryl. Benadryl's over the counter, I can abuse it. We've seen, I'm sure you guys have seen videos, well, maybe you're not. I watch a lot of videos, but you know, testimonials and, oh, I was addicted to Benadryl. That doesn't mean you can't abuse something, just because it doesn't physiologically do in the brain what addiction is. Christy? I think.
Yeah, hi. What is the difference between Benadryl and hydroxyzine? Why would one prescribe one over the other?
Very good question. It has to do with, and this is this is where I kind of went off on a tangent on the depression video. I went off on a tangent about how antihistamines work in the brain. So it depends on how it crosses the blood-brain barrier and the components of, so if, I'm not gonna get into that part, only because it will, I would definitely watch it, and because I think you guys, I think you'll think it's really interesting. And if you don't, you can fast forward through it because it's not on a test. But the difference mainly has to do with this chemical components. So it's kind of like saying, what is the difference between Prozac and Paxil? They're both SSRIs. They both do the same thing essentially, but they have a different chemical component. So Benadryl, very few people does have the opposite effect. Yes, we won't talk about that population, but it makes them actually hyper. It just does. We don't know why. It's rare, but some people actually get agitated on it. They just don't have a good chemical component. Their own chemical makeup does not mix well with the medication. But Benadryl in itself, the components and how it's made up molecularly and the structure just works different than hydroxyzine. That's the best, because they both do cross the blood-brain barrier. They both do go into the brain to cause people to feel, and when you watch the video, it talks about how histamine receptors help us to be awake. So if we cover them, and that's what Benadryl does, it covers them, and that's what makes you tired, is because it's covering something that's supposed to help you stay awake. It's explained much better in the video. But for this one, it's not doing that to the same level because of the way it is constructed. It all has to do with the molecular structure. That's why one person can take Paxil and they're like, oh my God, this is not working. I don't like it. It's not helping. But we switch them to Prozac. It's the same family, but it works wonderfully. So really that's probably the best way to be able to explain it. It's just, it has to do with the molecular structure, kind of like Adderall and methamphetamines. I've said this before, but just to kind of make the connection, I've heard so many people say, oh, Adderall is just the same thing as meth. No, it's not. I'm not saying, yay, go Adderall if you're against it or whatnot. That's not what I'm saying at all. But it is very similar in structure. However, it has about it's like one different chemical structure. You know how they build all the molecules, you guys have seen them, I'm sure, in books and whatnot. However, the amount that you would have to take, number one, the molecular structure is different, and number two, the amount you'd have to take of Adderall to even, and I hope I don't trigger anyone, but for like one hit of methamphetamine, you overdose. I mean, really, I'm being a little bit, probably being a little bit overdone, but really that's what it is. So hopefully that example helps a little bit. Did that help make the connection for you?
Yeah, thank you.
Oh, of course, same classification, different molecular structure. This one I find very helpful with my patients and my population with addiction. And again, I think it has just to do with the brain structure, and they tend to be able to handle a little bit more of, but not all. I'm making a generalization, which I don't want to do. I just turn this thing off of my computer. It's like, when don't turn it off, you're fired up again. Gabapentin, we know, is an anticonvulsant. We already talked about that. It's great, but since you can use it for so many things, please know why they're using it. That's also very important. And this can be a sedating medication. That's why, again, I love it. We can switch doses. It's very good. But can we just stop taking it? No, because what could happen? You have a seizure. I'm not talking you're taking 300 milligrams once a day for like 4 days a week. That's fine. But you always should talk to your prescriber. I'm not, please don't just listen to that. But I just say as a generalization to all my patients, never just stop taking it. It's dangerous. Hydroxyzine is fine. Just so you guys know. But SSRIs, SNRIs, and Boost Bar, you're going to have withdrawal, and you're not going to feel good. You'll feel like you're having flu-like symptoms. It's not fun. Headache, body aches. Propranolol, we know why we don't just stop this one, especially if we're taking it consistently, because we can have even though we're not taking it for hypertension, we could still have rebound hypertension. So the most common times I see this one used is usually not for, not saying you can't, but usually for a shorter term, and then we switch it to something else. It just depends on the patient, but especially if they have high blood pressure too at the time. So I see it used a lot in recovery and in dual diagnosis, because in dual diagnosis, I think we've kind of covered a little bit. It's when you have an addiction, and it can be process or substance, and anxiety. So like alcohol use disorder and anxiety, that would be dual diagnosis. Bipolar disorder and methamphetamine use disorder, that would be dual diagnosis. We tend to use this one because blood pressure tends to rise when those go into withdrawal from the drugs for alcohol addiction, and they're also feeling anxious. So this can play a nice part in double dipping, as well as it can, and I'm not going to ask you specific questions. I just want you to know that it can be used as an anti-anxiety medication off label, but it also can be used for the most common reason I've seen it or read about how it's used, but I don't see it used often this way, is for public speaking. This is a really common one for public speaking, because you're lowering the heart rate. So, you know, when your heart's pounding and you're scared, and because some people have that fright, and physicians will prescribe a couple of these and say, okay, go ahead and take this before your speech. All is good, all is fine. And then they give the speech, and it's for people that I've at least had the experience with, or I've asked physicians about it before, it tends to work really well. I mean, it's not perfect, but it really does help with the somatic symptoms too, because it helps to relax, because your body's feeling more relaxed. Now, a question I often get is, well, what about blood pressure? We need to take our blood pressure prior to taking it. Me personally, if I'm your prescriber, yes, I want you to take your blood pressure before you take this medication. If you're taking it once, 10 milligrams to give a speech, unless you've had problems with orthostatic hypotension in the past, or, you know, really low blood pressure, yes, but otherwise, no. For whatever reason, they don't really do this to, I don't mean to put you on the spot, Sophie, but did they take, and they may have taken the person's blood pressure for a different reason, but did they take the blood pressure, or were you in the room at that time when they gave propranolol?
Yeah, they did.
Did, okay. Did they, do you, again, I'm sorry if I'm putting you on the spot, but do you know if they had hypertension?
I can't remember. I know that their blood pressure readings were within normal limits, so that otherwise we wouldn't have given it. That's what she told me.
That's what I would do as a prescriber, just for safety. To be able to tell my patient, especially if you're taking this home, I don't want them bottoming out and then fainting, or, you know, bad things to happen. So yeah, that's up to the prescriber, but I definitely would take the blood pressure. So good nurse or prescriber, whoever was there on your behalf. So any questions about the off label? So these three are the ones I want you to know. I want you to know these. You don't need to know the 5-HTP part, but I just put that there. Okay, and we're gonna do this, the video. That's what I absolutely wanted to get done today, and then we'll see what time it is. My God.
All right, so that is the piece of that. So I'm gonna get this uploaded and thank you so much. I know it was a little bit long, but I think very valuable information.